Hello, welcome to Boosting You, the ultimate wellness platform. I'm Dr. Sue Peacock here with my lovely friend Shirley McLean. So we're in the middle of National Heart Month, and I think that's something that kind of affects us all, doesn't it? Whether it's directly or through loved ones. So today's chat is all about the heart and cardiovascular wellness.
Hi, everybody. So, heart disease, this is a fabulous topic because it does remain the leading cause of death in the UK. Did you know? We like a few facts, don't we, Sue? Um, but here's the empowering news. Many heart conditions are preventable through lifestyle choices. And again, it's that, I used to work in pharmacy, as you know, for years and years. Prevention's always better than cure. And me and Sue harp on about this all of the time. But this is kind of like quite prevalent with this, isn't it? So today we're going to talk about how to love your heart. Hmm?
Absolutely. So where do we start then? I think it's one of those things, isn't it, that many people assume that heart disease is something that happens to other people. You put money in the tin, don't you? If there's donations being collected, and that's all you think about it, or you think it happens to kind of older people.
Yeah, you're right. And it is a dangerous assumption, that, isn't it?
Mm.
Especially now because, things have actually changed with heart disease, haven't they? Because it can develop at any age, really, as well. And the habits that we form in our 20s, 30s, and our 40s significantly, impact on our health in later years as well. So the good news is that it's never too early or too late to make positive changes.
That's always reassuring, isn't it? So, what are the biggest risk factors do you think we should be aware of?
Well, the main one is high blood pressure, in high cholesterol, smoking, diabetes, being overweight, physical inactivity, and family history as well of heart disease as well. So, and many people have more than one of these risk factors. However, they don't even realise it.
That's quite concerning, isn't it? So, how do we know if we're at risk?
Yeah, well, regular health checks, that's always a great place to start, really. Those are
Yeah.
quite crucial, really. We don't know what's going on the inside, but if we have a few numbers and we get checks out, we can. So, everyone over 40 should have like an NHS health check, really, every 5 years. You can leave it a little bit longer than your car MOT, so we don't need to pay for it and go there every year and do it. But that's going to include things like your blood pressure, your cholesterol, maybe diabetes screening. But even if you're younger as well, if you have any concerns about anything or any family history, then go along, speak to your GP. That's what they're there for.
Yeah, yeah. So let's talk about what we can actually do. So, we know that diet plays a huge role, doesn't it? And we know that our hearts love, the whole foods, the fruits, the vegetables, the whole grains, the lean proteins, and even healthy fats like those in oily fish or nuts or olive oil. And, the research suggests that the Mediterranean diet is particularly heart friendly, doesn't it?
Yeah. So what should we be limiting? So
Well, looking at the research, it's suggesting that, reducing saturated fats, such as those found in sort of processed meats and pastries and fried foods, it's about perhaps cutting back on salt, which can potentially raise blood pressure, and maybe limit the amount of sugar that we add to things. I
yeah.
think, for some people, reading the food labels is really quite important because, salt and sugar hide in surprising places like tomato ketchup, for example.
Yeah, and I definitely been caught out with this in the past. Absolutely. Because foods that you maybe even think are good, even like smoothies, stuff like that, when you have a look at the context, when I did that, the gut health and learned a bit about our microbiome, it's definitely all about read the labels. We're just not aware of what's going on. And
Yeah,
what about exercise?
yeah, exercise or meaningful movement is what I tend to
Yeah,
look
that's what you say, isn't it? Yeah.
at. Exercise can put us off. So
Yeah.
I think exercise, meaningful movement is vital, isn't it, for heart health? The NHS recommends 150 minutes of moderate aerobic exercise per week,
Mm,
or 75 minutes of vigorous activity.
yeah,
And this doesn't have to be going to the gym or anything, like that, or it could be brisk walking, cycling, swimming, dancing.
yeah.
That gets your heart rate up. That crucially that you enjoy, because that's the main thing.
Yeah, and you're really ticking the box for that one at the moment, aren't you, Sue? With
Yeah,
all your marathon training, for your pain charity, aren't you? Because that's what you've been doing, isn't it?
yeah.
Everything that you've mentioned there, it sounded quite a lot when you said it all at once.
Absolutely. Yes. I'm not running a marathon this time, just a half marathon.
Yeah,
So, it's my
just feels
diary.
like it.
It certainly does sometimes at 7 o'clock in the cold morning. But yeah, I think the key for any exercise, any meaningful movement, it's breaking it down, isn't it? So, you know, that sounds like a lot, doesn't it? 150 minutes or whatever it is, but that's just 30 minutes, 5 days a week, or
Yeah.
even three 10-minute sessions spread out throughout the day. It doesn't have to be, all in one go. Um, the key is, I guess, consistency, isn't it? And finding the activities that you enjoy so you do actually stick with them.
Yeah, absolutely. And that sounds a little bit better. I can handle that mindful movement a little bit better. So, what are the signs when something might be wrong with our heart? When should we seek help?
Well, I think it's about, not ignoring chest pain or discomfort, especially if it, spreads to your arm, your neck, your jaws, or your back.
Yeah,
Shortness of breath, unusual fatigue, dizziness, or palpitations, do warrant a good checkup. And obviously, if you experience severe sudden chest pain, you need to call 999 immediately.
yeah,
Don't just call.
yeah. And it is vital information, that, isn't it?
Mm.
And and we know now stress affects the heart too, doesn't it?
Yeah, significantly so, doesn't it? Because chronic stress raises the blood pressure, and because we're stressed, we quite often take up unhealthy coping strategies, perhaps like overeating, smoking, drinking too much alcohol. But there are things that we can do to manage our stress that are perhaps better coping strategies. So
Mm,
mindfulness, meditation, adequate sleep, and doing activities that you genuinely enjoy will be protective of your heart.
yeah. And what about sleep? How much sleep do we need?
Well, there's a question, isn't there?
Depends who you talk to.
Talk to, and depends on you as a person, I guess, as well.
Yeah.
I think on average, most adults need between 7 and 9 hours per night, because poor sleep is linked to high blood pressure, to obesity, to heart disease. And there's quite a lot of information out there, isn't it, about good sleep hygiene. So it's a strange way of putting it, isn't it? Which is basically about keeping regular schedules, limiting screens before bed, having your bedroom kind of a bit like a cave, cool and dark, and all of those kind of things. And all of those things matter because they do impact on your sleep, which therefore impacts on your heart.
Yeah, and these are things that we have covered before, isn't it? And we will go into detail with when we
Yeah,
start doing our little, now we're starting doing our little time to talks of different things. We will go in and have experiences to help people that are experiencing, little problems in these little areas at the minute. What about, you mentioned before, like about other ways of coping. So what about alcohol? What about smoking as well?
well, smoking is probably one of the worst things you can do to your heart because it damages the blood vessel walls, it raises your blood pressure.
Mm,
I think if you smoke, the best thing for you, the best thing for your heart is to stop, basically. Um, as for alcohol, I'm not going to say stop, because everyone likes a little drink now and then, don't they? But if you drink, it's about sticking to the guidelines, isn't it? And having no more than 14 units per week spread over sort of three or more days during the week.
yeah, yeah, absolutely. Because our little, we can only process 1 unit an hour, and then that's when it starts having stress. So absolutely, just a little bit of what you fancy, eh? 80-20 rule. So let's talk about women
Mm,
specifically, only for a moment, you men that are listening, because I've heard heart disease presents differently in women. Have you heard that?
yeah, that's an excellent point, isn't it? Because women are often underdiagnosed because their symptoms are kind of less typical, I
Mm,
guess.
yeah,
Women might experience nausea, fatigue, or back pain rather than that classic chest pain pressure.
yeah.
And women's heart disease risk does is significantly increase after menopause.
Yeah, and that's really important, I think, for our listeners to know, really. So, before we finish, what's your key message for National Heart Month?
Well, today's key message for National Heart Month, I guess, is thinking about, well, your heart works tirelessly for you every single moment of the day. So perhaps, think about it, show it some love through regular movement, nourishing food, stress management, and not smoking. But don't worry, but you don't have to do all these things at once. Small, consistent changes do add up to major heart health benefits. I think it's also important, know your numbers, get your blood pressure and your cholesterol checked regularly.
Yeah, absolutely wonderful advice, as always. So, and I did mention before, I think this would be a great topic on our time to talk, just a little more understanding about the heart coherence and how our heart is deeply connected to our emotional well-being. So we've not covered really too much about the emotional and have a real experience with people. I think that'd be nice. Our stress levels and that relationship with others, it all matters with our heart. It plays such an important, huge role. So that would be an interesting one. I think we'll need to put that one in. And until then, here's to healthy hearts, and it's bye from me for now.
Absolutely. Here's to healthy hearts indeed. Bye from me.